Today's presentation is going to cover basic care of your PICC line, caring for and troubleshooting our PICC line. When caring for a PICC line, we're always assessing our patient, assessing the dressing, and assessing for patency. We assess our patient for any complications, any questions regarding their line, and assess the site for any swelling, discoloration, erythema, phlebitis, or bruising. Assess the dressing. When is the next dressing change due? Was it done within the 7-day window it was supposed to? What is the current state? Does it need to be changed? Assess the patency of the PICC line. For inpatients, this is twice daily and with every medication administration. For outpatients, it's at least every 7 days or with every medication administration. The reason we assess patency is partly to maintain patency and also to ensure that we have a working line in our patient. And we assess patency utilizing a 10 ml normal saline flush. When administering IV push medications, the first thing that we need to do is gather our supplies. We want to gather the medications we are going to be administering, 10 ml syringes, 1 per medication, normal saline flushes, the 10 cc normal saline flushes, and alcohol pads. To administer IV push medications, we of course start by washing our hands and putting on clean gloves. Always draw your medications up in a 10 ml syringe. The rationale for this is because anything smaller than a 10 ml syringe can create unnecessary pressure on the PICC line, causing it to break or burst inside of the patient. So regardless whether you're giving a half ml of medication, 1 ml of medication, or 5 ml of medication, always draw up in a 10 ml syringe. Be sure to clean your ends vigorously before administering the medication. More is better. Use a technique called scrub the hub and scrub for at least 15 seconds. Always before administering medications, check patency with your 10 ml saline flush. Instill your medication and flush with 10 ml of normal saline between each IV push medication. When you are completed, flush with 20 ml of normal saline. To draw blood from your PICC line, first gather your supplies. Again, you'll need 10 ml normal saline flushes, alcohol pads, your vacutainer connector, lab tubes, or your vacutainers, patient labels, and if you would like, a 10 ml syringe. Drawing blood from lines that are not in use or do not currently have a running infusion always starts, of course, with educating your patient, washing your hands, and putting on clean gloves. Again, vigorously clean the pressure end with an alcohol pad, using the scrub the hub technique for at least 15 seconds. Always check patency with your 10 ml normal saline flush. If your line is patent, flush in your remaining flush and keep the syringe attached. Then draw back 5 to 7 ml of blood and discard as waste. You can either attach your empty 10 ml syringe and aspirate the needed amount of blood, or attach your vacutainer connector and fill the needed amount of lab tubes, or once you have drawn the blood into your 10 ml syringe, you can utilize the vacutainer connector to fill the needed amount of lab tubes. Finish by cleaning the pressure end with the alcohol pad and flushing with 20 ml of normal saline. When drawing blood from lumens that are currently in use, we're of course going to start by educating our patients, washing our hands, and putting on clean gloves. You want to shut off the infusion unless it is a critical infusion. Then vigorously clean the lumen that you plan to use for a blood draw. Check the patency and flush the line. Then wait 20 minutes before a blood draw and follow steps 5 through 9. Which would include drawing back 5 to 7 ml of blood and discarding as waste, attaching your 10 ml syringe or your vacutainer connector and filling your lab tubes. Clean the pressure ends and flush with 20 ml of normal saline. Then resume your infusion. Possible problems one can encounter with their PICC line include no blood return, or aspirated blood is sluggish, the lumen flushes hard when you're trying to flush, it does not flush at all, one lumen works or does not work, but the others do or do not, or no lumens flush. Troubleshooting at the bedside includes checking for any kinks. Be sure that if there are any clamps that you have them unclamped. Check your flush. Did you break the connection on your flush before you tried to flush the PICC line? Ask the patient if they've had any problems. Do they have any blood disorders which causes their blood to clot? Try repositioning the patient's arm. If none of these are working and the patient has not had a recent one-view chest x-ray to confirm placement, you can obtain a physician's order for this to ensure the tip of the catheter is in the lower third of the superior vena cava. Once we have confirmed our PICC line is in the correct place and none of these interventions have proved successful, we can take a deep breath and consider our other option, and that would be to declot the PICC line. Declotting the PICC line is done with cath flow. Other names for cath flow include alteplase, TNcase, or TPA. It's a clot buster, not a platelet aggregator, but rather a thrombolytic. It dissolves the fibrin that makes up the basis for the blood clot. Don't hesitate to use cath flow. There are very few contraindications, the only contraindication being if the patient has an allergy to alteplase, or TNcase, or TPA. There are many considerations. It's a very highly efficient drug and very effective. To declot your PICC line, once you have determined the need is there, you need to obtain a physician order for 1 vial or 2 milligrams per non-working lumen, and then mix per the directions and administer. Resources for declotting your PICC line are located in many places. There is a VVRMC video on declotting your PICC line with cath flow. You can go to cathflow.com and look at the cath flow administration under Dosing and Administration tab. Cath flow frequently asked questions. Or here's another live demo video on YouTube. For information on changing your dressing on your PICC line, there are 2 VVRMC videos that you can watch. The CVC dressing changes or the PICC line dressing change demo video. And finally, if you want to know more about your PICC line in the form of anatomy and physiology, you can watch the VVRMC video Central Line A&P located on YouTube. Thank you for watching and enjoy caring for your PICC line.